One of the highly transmissible variants has already spread through a senior's home in Ontario with deadly consequences. Today, the Ontario government admitted it will miss its deadline to get the first dose of vaccine to all long-term care residents and other vulnerable people. One part of containing the spread of the variants is restricting travel. As Ross Lord explains, experts say Canada should have acted long ago.
You're always on edge all the time.
These are terrifying times for Debbie Grigg. Following the Christmas holidays, her 75-year-old mother, Evelyn, contracted COVID-19. The variant first found in the UK is tearing through her long-term care home in Barrie, Ontario. In less than a month, more than 60 residents have died.
My greatest fear is getting that phone call saying that my mother has passed away. It's, I think that's why I don't sleep most of the nights.
The suspected cause of the outbreak is travel. Health officials say it proves again how critical it is for people to stay at home. But researchers say containing the spread of COVID-19 variants will take more coordination than Canada has shown so far.
So there are different levels of jurisdiction, different policies across provinces. There's not a joined up whole of government approach to this.
The Public Health Agency of Canada says it's up to provincial and other health officials to warn travelers directly they might have been exposed to COVID-19 on commercial flights. But Quebec's Department of Health and Social Services said there is no individual follow-up with potentially exposed travelers, and that they are responsible for checking the Government of Canada website to see if a case of COVID was subsequently detected on their flight and to follow the Quarantine Act. Since the start of the pandemic, there have been more than 8.5 million border crossings into Canada. Canada Border Services says 74% of those crossings, or 6.3 million, were by people exempted from quarantine measures because they were considered essential. There's renewed pressure on the federal government to make sure its new travel rules work.
I think this should have been done months ago.
This epidemiologist suggests Canada is playing catch-up with the highly contagious new variants.
How much can we vaccinate before it becomes dominant? Can we harden our long-term care centers? Can we protect our healthcare workers? Can we be in a position to prevent a likely third wave in the late spring?
The new variants are not unstoppable. Almost 2 weeks after Nova Scotia reported cases from both the UK variant and the one first detected in South Africa, there's been no new outbreak. Health authorities credit the tedious but effective methods most Canadians have followed for almost a year and will be asked to continue practicing for the foreseeable future. Ross Lord, Global News.